been doing digital storytelling for a long time, and really excited to be here with you guys today talking about it, because it really is one of my favorite things in the world. Yes, I like doing movies and things like that, but digital storytelling, man, is just such a wonderful thing that democratizes the storytelling, video, audiovisual storytelling in such a powerful and profound way. And I can't wait to talk a little bit more about our work, in particular in southwestern Uganda. And the photo you see on the slide there is from my first trip to Uganda almost 4 years ago now, where I taught my first digital storytelling facilitator training workshop. And since then, they've done some amazing work, and I'm really excited to talk about that. And the one thing I guess maybe that wasn't shared in the bio is my PhD work was entirely on using digital storytelling in healthcare contexts, health and wellness context. So a lot of the stuff you're going to see today came from my PhD work, but also some of the other research projects that we've had going over the last few years. So I'm just going to jump right in. We're going to watch a story today. We're going to have some conversation. We're going to share a lot more about our project. But before we jump into all that, just a couple disclosures. I do run 2 private businesses related to digital storytelling. One where I produce and direct films and facilitate digital storytelling projects related to health and wellness, called Michael Lang Stories. And then Common Language Digital Storytelling, which is the one affiliated directly with this project, where we train digital storytelling facilitators all over the world. And like all global health projects, there is 1,000,001 partners, and they've all contributed in such profound and meaningful ways. So I want to acknowledge them really quickly. Mbarara, University of Science and Technology, we'll talk more about them, and Healthy Child Uganda. There's also the University of Calgary in partnership with them, the CHR for funding my PhD research, and then of course CAGH and CanWaCH who are partners on this particular project that we're going to be talking a little bit about today. There's the Wellcome Trust for funding our very first projects in Uganda. So there's so many people involved here, and it's just me presenting today. And so I just wanted to thank everyone and all their dedication and hard work that sort of brought us to this moment to be able to talk about the things that we've been doing in Uganda. Why storytelling? I think, most of the time when I share this slide in a lot of contexts, I'm sort of preaching to the choir, right? You're here because you understand the value of storytelling. But I really like this one quote from Dr. Rachel Naomi Remen in her book, Kitchen Table Wisdom. Facts bring us to knowledge, but stories lead to wisdom. And I think intuitively, most places in the world, most cultures and societies understand the stories and wisdom piece. But I think historically, maybe in Western societies, we've undervalued it and sort of overvalued the facts and knowledge, right? And what I love about storytelling just generally is it can really sort of rebalance our Western mindset to realize that, facts and knowledge matter, but stories and wisdom also matter. I work a lot in healthcare contexts where data is sort of primary, right? That's what matters the most. And I've sort of seen a rebalancing over time, which is sort of exciting to see that we're valuing individuals' lived experiences in a different way in healthcare settings. And it hasn't always been this way. Actually, the ancient Greeks have a word for this, phronesis, practical knowledge or wisdom. And they actually, certain schools of thought valued phronesis above all other types of knowledge. And so it's sort of cool to sort of think about how we can bring the value of stories back into the different contexts in which we work. And, the other wonderful thing about storytelling is that in particular, auditory and video-based storytelling has a significant influence on beliefs, attitudes, values, and behaviors. And that pretty much describes, I think, most, public health and global health initiatives, right? That's the stuff we're trying to influence. And that's why stories are a great way to sort of approach some of these challenges. And that photo you see on the screen there, that was my very first screening that I got to attend in Uganda with a bunch of university students from nursing and medicine and gender studies. And we watched the stories that we made, that were made in that first workshop. And man, it was such an awesome night. We literally had to kick them out. It was a Friday night. Bunch of university students, and we talked for hours, and the conversations were so insightful and profound. And man, it was just so cool to see sort of the cross-cultural nature of a good story that's well told and how it can really impact people in many ways. I just got to be a fly on the wall and just take it all in. And it was just a really cool night to see what's possible for digital storytelling in different areas of the world for me. So let's start with a story. I think it's time for a story. We're going to watch one of the stories that was made with a village health team leader called Kenneth. And as we go throughout the presentation, we're going to talk a little bit more about Kenneth's story and where it's gone from here once he made it. But I wanted to give us a chance to chat really quickly about his digital story. So as you watch it, think about one thing that resonates with you in Kenneth's story, and then we'll have a chance to have a little chat about it afterwards in some small breakout rooms. So here we go. Here is Kenneth's story.
In our village, death rates of pregnant women in labor and their babies were so high. The distance to the health facility is very far, and some mothers have no transport plan to these facilities. Cultural beliefs of home deliveries, influence of mothers-in-law, friends, and poverty. Lacking maternity dresses and clothes for which to receive their newborn babies hindered expecting mothers to use health facilities. Besides, health workers in the area were very few to do the required mobilization and sensitization of mothers. Being a health worker, I would be asked to give a speech on how these alarming deaths could be controlled. More so, I would be annoyed on how body functions of mothers and babies were normalized and celebrated with music and food rather than saddening and unfortunate incidents. So, following the government health programs, together with other health workers in the district, I got training of trainers in facility skills to involve community health workers who filled the gaps in service delivery to address maternal, newborn, and child health care. This is when I saw my dream of changing and reducing death rates becoming visible. Furthermore, to enhance local support, I consulted the local leaders who got involved in mobilization and sensitization, which created a bigger platform of the community involvement. I was happy to see everybody on board in the reduction of the death toll of our mothers. I began to see an improvement in attendance of village meetings, home visits, and state of hygiene, antenatal care, and health center deliveries, referrals, and follow-up made and implementation of what mothers were advised to do. I also got to know of mothers' challenges they face at the health facilities, including absence of health workers, lack of medicines, and poor or no infrastructure, which were hindering the mothers to go for health services. Here, I talked to the health worker to be present or notify their colleagues in order not to frustrate the now motivated mothers in the health-seeking behavior. Although sometimes the number of women who visit the facility vary due to poverty and lack of husband involvement, the death rate in labor is history in Kibali. With the support of the Health Child Uganda and my coordination with committed health workers, community health workers, and local leaders, the various speeches are no more, and my dream has come true. I feel very happy that together we have achieved what seemed impossible. Thank you.
There we go. Kenneth's story. Awesome. We'll get a chance to follow what happened after Kenneth made his story in a little bit. But yeah, we're gonna open the breakout rooms, and with your small group, maybe just share one thing that stood out to you or resonated with you in Kenneth's story. And Jessica, you can go ahead and open those breakout rooms. Just click join, and we'll see you back here in just a couple minutes. Wonderful. Welcome back, everyone. Hopefully you were able to have an interesting discussion around the story. And I was popping in and out of a few different groups, just sort of eavesdropping a little bit. And yeah, there's many different ways that you could view Kenneth's story, depending on what pair of glasses, what frame of reference you're bringing to the story. And that's actually one of the best things about a digital story, right? When you share this story in the community to community members, they'll view it in a certain way, right? When you share it with someone who's involved in global health, they'll view it in a certain way. And one of the powers of a good story that's well told is that everyone can pull different things from it that are meaningful to them. And in that way, a story can actually connect us all in many ways, right? There's commonalities that we can find with each other and with Kenneth and with that context in the story, no matter where you are in the world. I heard a couple of people mention, the maternity dresses was an interesting one they hadn't quite heard before, of what could be keeping people from going and delivering in the health center, and so there's new ideas that can come out of these stories, but there's also just a lot of different sort of approaches depending on where you're coming from, how you interpret this. So thanks for sharing what resonated with you in the story. Generally, there's lots of different things that people find in a story, depending on where they're coming from. So really quickly, where are we going for the rest of the day here? Well, we talked a little bit about digital storytelling. We're going to share a little bit of the framework that we use and some of the modifications that have come out of the work in Uganda. And I'm just going to very, very briefly touch on some ethical principles and then share some final thoughts. It's a lot to pack into the next 35 minutes here. So here we go. So the 4 phases. This is this is a direct result of my PhD work and sort of the foundation of the DST, the Digital Storytelling Facilitation Training that I developed and delivered in Uganda. And I created this because I found, some of the other classic or traditional frameworks out there seemed a little more linear or formulaic, even if they weren't intended to be so. And I think when doing digital storytelling in health and wellness and global health contexts, it's good to have sort of a way to organize activities. But those activities themselves need to be very fluid and flexible. And so the framework here is sort of organized into buckets of activity. So finding, telling, crafting, sharing. And the citations on the screen there sort of go into these things in more depth. We're going to do a little bit of that right now. And then the bottom one there is looking specifically at using storytelling as a knowledge translation intervention for health promoting behavior change. So those are 2 things people may be interested in checking out on their own time. The main thing to emphasize about sort of the framework that we're talking about here is that there is a form to digital storytelling, but there can be no formula. And, as one of the founders of digital storytelling, Joe Lambert, says in his book, restless, constant experimentation is the core of digital storytelling. And so, that's sort of the idea behind this, is that it gives people a bit of a framework to use, but obviously it's sort of endlessly modifiable depending on your context and where you find yourself. So I'm just going to go through it really quickly right now, just some of the basic sort of overarching tenets of the framework. So for finding the story, one of the first things we talk about is listening deeply and following leads. And a lot of the stuff we talk about here comes from the field of philosophical hermeneutics of Hans-Georg Gadamer and some of his concepts of fusion of horizons and genuine conversations. And through these sort of ideas, we get a deeper understanding of how we can follow leads and find stories that are really meaningful and the story that people want to share from their life or their health experience. Another one here is finding the third thing. And this is actually a screenwriting concept from a person named Robert McKee. And it's centered around the idea of using our creative powers, our imaginative powers, to find a third thing that connects to seemingly disconnected things, to create a theme or an idea. And this is actually a very powerful thing. People often don't think about their life as a story. And so when they find meaningful moments in their life and are able to connect those moments with a third thing or a theme, all of a sudden they have these powerful stories that have something to say. So really the general overview idea of this finding the story is you start with moments and then you ask why until you have a story. And that's just a general sort of approach to helping people find meaningful health stories in their lived experience. So the next part, telling the story. Here in the training, we talk a lot about metaphor and imagery. And this sort of comes from the idea of Paul Ricoeur. And he talks a lot about the power of metaphor and imagery to cultivate understanding. And exploring his thoughts, his philosophical thoughts around how this occurs can help us use this tool in really powerful ways, using metaphor and imagery. And in Kenneth's story, right, there's the coffins. He actually went out and take that photo because he wanted to show, it's a bit of a jarring photo for some, but he wanted it to be jarring. And using that image of the coffin was something that he did on purpose, in a purposeful way, to cultivate a feeling in the audience. Another thing we talk about is 3 levels of conflict. And this comes from an author named Donald Miller. He talks about how all good stories have 3 levels of conflict: external, internal, and philosophical. And when you're telling the story, it's good to tell it in a way that hits all 3 levels of problems. Another one, and this is again from Robert McKee. It's called dramatized diexposition. And he writes it as a commandment because this is one of the most important things that people need to do in order to tell a meaningful story. And basically it means just embedding important information into a narrative context so that the audience absorbs this important information without noticing. And I think in healthcare we like to share bullet point stories about people's lives, that's sort of like, this happened, then this happened, then this happened. And that actually isn't a story. It's called a technical account. And it actually has very little value to change beliefs, attitudes, and behaviors because it's unable to achieve something called narrative transportation, where you are literally transported into that person's life and you live it with them. That's where a lot of the sort of the value comes from in storytelling. And the technical accounts that we're used to sharing in healthcare actually don't do that very well. And so, one of the overarching principles about telling the story is this idea of hermeneutic excess, right? Is that tell the story in a way that people can take what they need from it, right? So depending on what pair of glasses they come to this story, they're able to pull out something that's meaningful for them. So, again, we spend hours on a lot of these things, talking about these things and lots of activities, practicing these different ideas and concepts. But this is just the general overview. Crafting the story. This, on paper is the most straightforward phase, right? You select images, you use video editing tools to put those images together. You record the voiceover and then you put some music behind it, right? When you watch a digital story, it seems relatively simple in some level, right? But on paper, yes, simple. Watching a story simple, but in practice, it's very complex. And you could spend your entire life learning about this one phase and still have room for improvement. But really, what we talk about here, because of course we teach all of these different things. How to use a video editor, selecting images, finding images, all that stuff. Really what you're talking about here is how to make people feel the story in addition to understanding the story. It's how they feel. And that is all about aesthetics. And so this is a bit more advanced storytelling concepts. But there's lots of things that you can do in digital storytelling to enhance the feel, the things that people, the way that people connect to a story. So things like pacing of the story, timing of the images and the voiceover with the music, and transitions between photos. You use different transitions to create a feeling. Moving the photos around the screen. You can crop photos to de-identify a particular place or time or person. And there's, of course, all sorts of different video editing effects like colors and blurs. In Kenneth's story, you saw how there was a moment where he was speaking to a group of people at a funeral, and that photo is black and white, and it fades into this black and white photo of the coffins, right? Color creates a feeling as people are watching it, right? So all these things really matter. You're really trying to pull the viewer and transport them into the narrative that they're watching. And so we talk a lot about aesthetics, how we can use things like this. And I think, this sort of hints at one of the most pervasive things that sometimes I experience when people watch digital stories is they think, oh, it's very simple. We can just throw people in a room with some computers and we'll come out with some incredibly compelling stories that are capable of changing beliefs, attitudes, and values. And really, that's simply not the case. That's why I think a level of training is important in order for you to be able to craft stories that can influence people and change behaviors. And so that's a little bit about the crafting the phase. Sharing the story. There's many purposes for sharing a story. And we'll talk a little bit about this in a minute. But obviously, there's educational aspects of when you share a story for a specific educational purpose or to start a conversation. There's advocacy, right? Advocating for mothers and their children. There's the research aspect of it, right? You can actually learn a lot from a digital story if you sort of look at it as a data collection activity. And then there's also therapeutic intent, right? You can share the stories to help others. And in Uganda, they've done pretty much all of these things at this point, for different times and places, sharing the story for different reasons. Really, the best part about a digital story is that it starts meaningful conversations. Right? We just jumped on Zoom with a bunch of random people from across Canada or around the world, and we were able to talk about something, right? Talk about maternal and child health through Kenneth's story. And really, that's the best part about it, is they start meaningful conversations. And so sharing the story is really about, okay, how can we, now that we have these stories, how can we share them in a meaningful way and have meaningful conversations about it? And so, this is one of the hardest things. And this is one of the things we're thinking a lot about now that we are, doing a little bit of looking into the experiences in Uganda. We're thinking a lot about this phase because I think there's so many opportunities here that we haven't really fully explored yet over there. So yeah, what about Uganda? I give you a brief overview of the methodology so you can sort of appreciate all the modifications that they've been making within these buckets or phases of activity, right? Finding, telling, sharing, crafting, sharing. They're over the past 4 years in Uganda, they've made almost 60 stories now on all sorts of topics, from child and maternal health, youth and adolescent, sexual and reproductive health, COVID, or just general life experiences, that are meant to reduce stigma or influence gender norms, things like that. And in many ways, they've been very successful. And of course, we're still learning and developing, but we really believe that their experiences could help, translate to different areas of the world. And the current project that we're working on with CAGH and CanWaCH is all about gathering information from the Uganda team that then can be used to create a scalable digital storytelling facilitator training and mentorship program that then can be sort of used in lots of places around the world. And digital storytelling, it is used a lot already in global health and public health. But often, a lot of the projects, at least that I see in the literature, it's people from sort of global health organizations in Western countries come over and help people create digital stories. And what's different about this is that it's training local people to tell local stories and giving them the tools and ability to do that. And so it is slightly different. I think that for many years, Westerners went over and told stories for other people around the world. And it's so cool that right now, ever since the invention of these little things, right, these little smartphones, anyone can create meaningful digital stories relatively easy compared to even just 10 years ago. And so I think the moment is a really good moment to start to really democratize the storytelling experience, the video storytelling experience. And that's what we're really focused on in the project. And so we're in the very early stages that we've begun data collection. But we haven't, we're in the early stages of analyzing all of this data. So what I'm going to share with you now is incomplete in many ways. But there will be opportunities in the future to learn more, in particular at the conference, CAGH conference in November. I'll talk more about that in a bit. So here's some of the things that have changed, or that the Ugandan team has modified within these different buckets of activity of digital storytelling. The first one, and maybe one of the more significant ones, is that they've really created this team-based approach to digital storytelling, which I think is wonderful. They sort of have a facilitation team. Sometimes it's a dyad, so they have someone who's really good at helping people find and tell their stories, and then they have another person who's really good at helping them craft the stories, the technical side of things, and share the story. And so using sort of a team-based approach is I think a made in Uganda approach that seems to be working really well for them. One of the things that we talk about with that, though, is the challenge of maintaining a continuity of relationship. And so we're currently thinking through this challenge and how we can sort of help maintain relationships, even if multiple people are working with someone on their digital story. Another one is participant recruitment. I love this one, training village health teams or people out in the community to identify potential storytellers, right? Digital storytelling is not for everyone and not for every context. And so helping people understand, sort of who might be a good participant in a project like this is actually really important for sort of maintaining storyteller well-being. So it's sort of a core ethical principle of digital storytelling. And so I think training people to identify and recruit the appropriate people to create digital stories is another really great sort of thing that the Uganda team's doing. And then finally, for Finding the Story, they have their own studio, which I think is amazing. And by the way, if you guys are on here, I still haven't gotten to see photos of this, so you got to send me some photos. But yeah, they've created their own digital storytelling studio that has a place for recording voiceovers, has computers, and it's just a separate space where people can be engaged in this. And part of the data collection that we've done, we've been interviewing a lot of storytellers and facilitators and sort of trying to explore what their experiences were around making their digital story. A lot of what we've heard is that the environment that's created really matters in the caliber of the story and in a person's experience. And so part of that is the studio creates the right environment. The facilitators help facilitate the right environment. But yeah, that helps people feel really comfortable when they're sharing stories, especially stories that maybe are a little more, difficult to share. So that's some of the modifications for the finding the story phase. For telling the story, one of the things is working, with low literacy populations. Storyboards have been really helpful. And again, this is something that's been used in many different contexts of global health for many years, but it's just sort of something that has worked really well in this context as well, with digital storytelling in Uganda. Also, this is directly from some interview transcripts and stuff. I haven't had a chance to follow up on some of these things, but note taking, so as someone is sort of finding their story, there's someone else taking notes and sort of helping bring them all together, bring thoughts together, so that then when it comes to writing of the voiceover, then it sort of is a little easier to start. So having an external note taker during a conversation could be another really great thing. And then finally, this one's really interesting, the storytelling skills. There's one storyteller in particular that after creating their digital story and going through this process, they felt like they really became a better storyteller after working with the facilitators, and went back and shared their digital story all over the place, and eventually was nominated by their village health team to become their liaison person, their spokesperson. And now she connects with all sorts of different groups talking about the work that they do, because she actually, through this process of telling her story in a digital story form, became a better storyteller. And she's sort of been promoted in that way to be the spokesperson for their group. So there's a couple there. Crafting the story. One of the biggest challenges that has been, the Uganda team has been facing is finding meaningful images, context appropriate images. because sometimes, you don't take your own photos. Like Kenneth's story was a lot of his own photos. But if you're telling, particularly sensitive stories, you might want to use a lot more stock images. And stock images are hard to find. And so we have a camera. Kenneth went out and actually took a lot of his photos himself during the workshop portion. But that's something that you going out and taking images is something that the Uganda team has had to do quite a bit, and is also still one of the things that we're working through quite a bit. Editing with consent. This is a really interesting one, because of the time and effort that goes into making a digital story, which is significant. There's certain people who can't commit as much time, right? Travel all the way to Mbarara, be there for a full day or a weekend, or, multiple times traveling into the city. And so they've started doing some editing with consent, where they build the storyboard, they record the voiceover, and they sort of select images. But then someone actually, the person can go home, they put it together, doing their own editing, and then the person comes back and watches it and makes any changes from there. So it sort of, can make it a lot more accessible for people who don't have tons of free time to be able to work on something like this. And I think that's a really great approach. Does it really matter if the person themselves clicks and drags their photos into the timeline and adds the transitions in? This is something sort of we're thinking through right now. Of course, there's value in that for people being able to use the technology themselves. But in certain contexts, in certain places, to maintain storyteller well-being, doing a lot of the editing for them may be valuable. And then finally, de-identifying storytellers. The Uganda team, they jumped right in to the deep end when they decided to create digital stories about youth and adolescent sexual and reproductive health, right? A bit of a taboo subject in southwestern Uganda, and the stories that are shared, you have to consider the implications of these stories. We'll talk about ethics in a minute, but and because of that, they've had to come up with sort of lots of ways to de-identify storytellers in particular, to minimize the potential for harm for them. And some of those things are, voice modulation, right? Someone records their voiceover, but then we change the voice pitch, so you can't understand who it is, using lots of stock images. And so that's something the Uganda team has gotten really sort of good at, despite because of the topic area, I guess, that they have been exploring. And also, they've done it in a way that maintains storyteller well-being, and also it maintains the core of the story, the most important message. And we know this because we interviewed someone, and I sort of was looking through the transcript, but they were in the room when their story was shown, and they just really appreciated the conversations that were happening in the room, and yet they felt very comfortable being there despite of the topic area, because of the way that the story was told. And so that's sort of an ideal situation, and it brings us to the final phase of sharing the story. We have a collection of stories now, 60 stories, and they've been shared in multiple different ways. But like I said, this is one of the biggest things that we're trying to work on now. But here's some of the things, this digital story has been shared on the radio, which is really cool. The music and the audio still can have a powerful effect, right? There's been Zoom screenings. I think especially during COVID, there's a couple of Zoom screenings that were done. Of course, there's been in-person screenings, maybe not as many as we would hope, but there has been those. And then also targeted informal sharing. And this brings us back to Kenneth's story, because this is one of the very cool things about Kenneth's stories. He has taken the sharing upon himself. So really quickly, what happened? So Kenneth created this story almost 4 years ago now, I think maybe a little less than that. And so we talked with Kenneth a couple of weeks ago. I wasn't there. Sorry. The Uganda team interviewed Kenneth, and I got to read the transcripts and talk to them about it. And here's some of the things that he said about his experience of creating the story. First of all, he said it's not easy because of the short time, right? There's a challenge around photos, and he was not entirely prepared coming into the process. Of course, this is our first workshop. I think that we've gotten a lot better. The Ugandan team's gotten a lot better over time at preparing people, but he had to go home and take some photos and bring some photos back. He also said it was not easy using the computer. And so he appreciated the direct one-to-one support of the facilitator. And this is another thing that has been used in Uganda that's different than other things. Sometimes these are not workshops it's a facilitator or even two facilitators working directly with one participant. In a workshop setting, in low resource, low technology and settings, it can be really hard to work with multiple people at once. And so working one-to-one is a really effective way. And that's different than your traditional digital storytelling workshop where there's a group of people all working together. But he liked that, that direct one-on-one interaction with people. He also said, that he had all the words and the facilitators just guided him about how to organize them, and that he felt like this was 100% his story, despite sort of the help that he received in putting it together. He said, sharing the story in that screening and with the group that he made his digital story with made him feel touched and relieved because he felt like people were learning. And so when he went home, how did he use his story? Well, he took it home on a flash drive, right? We give everyone a flash drive or some way that they can have a copy of their story. And so he started going to places in the evening where people are watching TV. And he said, hey, while you're watching other things, let's also watch this educational video. And he plug it in, his USB key into the TV. And he says, whenever I play it, everyone pays attention, watches and listens. And, he's been doing this in lots of different ways. Anyone who has a TV in the community, basically, I think it sounds like he goes over and plugs it in and says, let's watch this story together. And then also at the health facility that he sort of in his community, they have a solar system where they have some electricity and he's a small personal screen, and he shares the story directly with mothers who come for antenatal care. And then he can also translate for it. It's in English. He can translate for it as they watch it. But he said, even if he doesn't, it's surprising thing is that people still pay attention and learn, even if they don't actually understand the words that he's saying. And most importantly, he's had many great conversations after sharing this story. And one of the things that has come out of him sharing this story is people obviously didn't realize, that some of the barriers that were facing moms. And so they've now in his district created a resource map. So a map with all the different resources for mothers and their children. And it's been, I think, really effective. And I can't wait to learn a little bit more about it, maybe see what it looks like. And one of the things he hinted at in the story, but one of the things now that he said in his interview, and we haven't independently confirmed this number, but if we do, man, that's an effective health intervention, isn't it? 98% of mothers deliver from health facilities. He feels like sharing his story, right? And changing the culture in his community has had a huge impact on that. And I can't wait to eventually, hopefully, talk with Kenneth more about his experiences. I feel like there's so much I can learn from him. But that, to me, really shows what's possible with digital storytelling on a local level around the world. If we can help people, health promotion facilitators in the community, create their own stories about topics that matter to them and their local community, and give them the opportunity to share that in many different ways. Stories change beliefs, attitudes, and values. And obviously that has changed in Kenneth's district. I think it shows, all the possibilities are represented in that one little digital story. So I wrap up in just a second here, but I wanted to quickly identify ethics or as something that's really important because I know a lot of, academics like myself, sometimes we get a little twitchy and nervous, when we think about de-identified stories, right? Or non-de-identified stories, right? There's many ethical challenges that arise when people share stories from their personal life in a very public way. And in the training, we almost do an entire day on ethics. And this is still one of the things that we talk about the most when I sort of have mentorship calls or communications with the Ugandan team. And in my thesis, I wrote an entire chapter on ethics, and I called it Beyond the White Gloves. And, I think in academia and healthcare, we want everything to be spotless. Right? We're like butlers walking around the hallways trying to find dust on the lampshades and making sure everything's spotless. But in practice, just outside the door of the halls, the hallowed halls of academia, there's dirt everywhere, right? It's muddy and it's messy. And we need to trade in, maybe some of our butler gloves for some work gloves and get ready to dig in the dirt a little bit, because digital storytelling can, the ethical side of it can be difficult to figure out. It can be messy, can be challenging. But, this is one of the main reasons why I think doing a digital storytelling facilitator training, and then ongoing mentorship is really important in global health context. It'd be one thing, just to create a little guidebook for how to do digital storytelling. But I think you can do that, but I think it's entirely different to do in-depth training and mentorship to ensure that storyteller well-being is maintained and even enhanced while also fulfilling project goals. And to me, this is the ethical imperative of digital storytelling in global health settings. When you watch a story, it seems simple. Write a story, put some images together, but in practice, it's incredibly complex and requires dedication to the craft, reflexivity, ongoing evaluation and mentorship. And that's really, I think, where we're going next. This presentation is meant to just be, just a little tip of the iceberg, a little teaser, because with the CanWaCH and CAGH and UFC and Mbarara University, we're working on, bringing all this information we're learning and building a more comprehensive training program that can be rolled out around the world. And that's really where we're going from here. We're going to be digging into some of these brief overview that I've given you and create some future plans. And at CAGH in conference in November, hopefully some members of the Uganda team will be in the room with us. And I hope that you all attend that session where we're going to continue the discussion that we started today. We're really going to be digging deeper into this. Also, I wanted to mention there is a survey that I think Jessica is going to put a link to in the chat. We would love for all of you to fill out that survey. It will be a major help to us as we sort of think about the future and explore how we can take what we're using in Uganda and maybe help translate it and spread it around the world. And so if you can, please fill out that survey using the link in the chat. That really matters to us. That will really be important because we're hoping that in the future, maybe some new partners are actually here on this call and are, we'd love to know what you know about digital storytelling and what matters to you in the work that you're doing to help us plan for that. Finally, feel free to reach out to us. If you just can't wait till November, I put my, so you can connect with me through that email on the screen there. You could also follow up with CAGH or CanWaCH, and they could put you in touch with the people. We really want to continue building momentum around this work, and we're happy to chat with any of you about it. And finally, I would say thank you all for being here. I'm a firm believer that every story we listen to and engage with changes us, even if we can never know exactly how or to what end. And Kenneth is a part of your story now, and you are a part of his story. And I think that becoming part of each other's stories in this way will ultimately lead us towards a more just future. So thank you for being here. And I think we got a couple minutes for some questions if people have any. I'd love to engage with you on those as well. So thank you. Jessica, I'm not sure if there was any questions in the chat, but if you have a question, unmute yourself, ask away.
There was one question in the chat.
Yeah.
How do you account for the effect or impact of other projects, behavior change activities that may be going concurrently in the same area? And could you create contamination or cross-fertilization?
Yes. How do you disentangle the many things that are going on at the same time and tie it directly to a digital story? Welcome to the messy world of digital storytelling, right? Anything that's designed to change beliefs, attitudes, and values, how can you measure that stuff? That's difficult to do. And so I would say, we're still working on some of these things, some of the different metrics to sort of explore the impact of digital storytelling. One of those is something called SROI, social return on investment. So it's like for every $1 inputted into this project, here's the social return on it. It's a ratio, sort of quantify maybe the impact of a story in some way or another. But ultimately, it's very difficult to disentangle a story and all the other things that are going on when you're talking about changing beliefs, attitudes, and values, because it's so multifaceted. It's hard to isolate one thing. Because of this story, this happened. over the long term. In the short term, yes, you can do pre-post surveys, changes in beliefs, attitudes, and values before watching a story and then after a story. But the long-term impacts of stories are difficult to figure out and disentangle from other projects that are going on. The one thing that I would say about that is maybe one story, right? One story may not have a massive impact in the same way that, we believe Kenneth's story did. But a collective of stories, together, stories have a huge impact, perhaps the biggest impact on changing beliefs, attitudes, and values. And so whether or not you can tie a big cultural behavior change in a community directly to a digital story, to me, is not perhaps as meaningful as just making sure that those stories are being told and used and shared, and sort of trusting our intuitive understanding as human beings that stories change us. So it's a great question, and it's one that I think all digital storytelling researchers out there are grappling with. And to me, I think we need to get more stories out there in the world, and start sharing them and using them. And I think after we do that, we may have a better idea of how we can measure impact and outcomes. Yeah, it's a great one. I see another one in here. How do we take up knowledge translation through digital storytelling? This is great. I mean, I would say this. I would say digital storytelling is knowledge translation on sort of the most organic, basic level. And sometimes, if you have a specific sort of piece of knowledge that you're trying to translate, you can actually look for storytellers related to that. You can put out a call into the community. We found that this is important to mothers. Is there anyone who is willing to tell a story about this particular topic, right? And then maybe you have a few people come and say, yeah, that mattered to me when I was pregnant, and so I would like to tell the story about that piece of my pregnancy. And so you can actually sort of use data to approach communities to look for stories that are related to that data. And ultimately, one of the things, though, that I've always found is that if you do a good job as a researcher, the stories that people are telling in the communities that you're working in will always be directly tied to your research outcomes, right? If they aren't, then that means you've missed something, right? You haven't done a good job of capturing the experience of that community. And so often when you just go to the community and you say, tell me a story about your pregnancy and childbirth, they will talk about things that are connected already to your data without you even asking. And so that's a bit of a reverse way of thinking about knowledge translation. But if you do a good job as a researcher, I think that the results are always tied to the stories people are telling. Yeah. There's one more here. We've got one more minute. What's the ideal length of your digital stories? Ideal length is really interesting. It always is, and it depends. But generally, digital stories are between 2 and 4 minutes, sometimes 5 minutes, 6 minutes. I mean, really, the length of the story is more tied to the amount of effort that it takes to make one. A longer story takes a lot more time and energy to create, and for certain people or populations, that may not be feasible. And so it seems to be a 3 to 4 minute story is the right amount of effort for the maximum sort of amount of value for the story itself. But of course, if it's a very engaged person, a 6 minute story in the right context could be just as valuable as a 2 minute story. So yeah, that's a hard one. It depends answer. So yeah. Great. Well, the final thing, I'll just read off what Jen was saying. We found that stories as an excellent opening for dissemination events, as they're much more interesting and well understood than a graph, and also are used to engage decision makers. Yes. A lot of people in their knowledge translation activities, we need to contextualize the data that we have. If we start with a story, and especially one that's capable of transporting us into that person's life for 3 minutes, everyone will care a lot more about the data that you share following that, right? Because they are tying it directly to the person that they just got to live with for 3 minutes. And so, if you're going to be sharing results about child and maternal health, starting with a story like Kenneth's, is a great way to contextualize that data, but also to make people more emotionally invested, more engaged in the content that you're going to share. So great. There we are, 1 minute over. I will stick around for a few more minutes, but thank you again for being here. Like I said, this is just the start of what we're hoping to be a very productive and ongoing conversation, and potentially many partnerships in the future. So thank you for spending your lunchtime with us, or wherever you are in the world. Thank you for joining us. And hopefully we'll continue to connect after this as well.